through universal health coverage, through Taifa Care, where every Kenyan will be insured eventually. Every citizen of Kenya will have will have access to a medical cover. It's not a small matter. Even developed countries have tried universal health coverage without success. President Obama in 2016 brought Obamacare. It was controversial, it was politicized. It went to the Supreme Court. Much of it was removed by the Supreme Court. But the American health insurance scheme today that serves them are the vestiges of Obamacare until today. And therefore, even for us as a country, we have had false starts before. President Kibaki tried it when Charity Ngilu was Minister for Health. Politics came in and the state rolled back. In President Uhuru's second term in 2018, when Cecily Kariuki was minister, Uhuru came with the big four. One of the big four was universal health coverage. Politics set in, the state pulled back. This time round, President Ruto has decided we'll not pull back. We will proceed with this transformative intervention because of its potential to really save on household incomes. A lot of families have become poor because of too much expenditure out of pocket on health bills. Many of the middle class, many of us, especially politicians, we have participated in endless harambes, and the only way to make sure that we save our money and the middle class saves its money is to reduce the number of people doing health-related harambes. The program is just started 2-3 months ago. You expect it to have teething problems. And that's why we are asking for your support, even as we convene next week to look at where the gaps are, the two levels of government, to perfect. And our argument as national government, led by President Ruto, is that you better have a not very perfect system of medical insurance than no insurance at all. So today, for example, previously only 9 million Kenyans were insured under NHIF. Today, 19 million Kenyans are insured. So you are better off with more Kenyans insured with a scheme which is being improved than have many Kenyans who are left for, to take care of their medical situations through drinking herbs and concoctions and seeing witch doctors. So we are on course. We want to target around 40 million, 45 million Kenyans in the shortest time possible. And when we meet and consistently keep on reviewing, this program will transform Kenya. You will understand NHIF only used to insure people who either have a salary or the ability to pay. This Taifa Care is insuring everybody. The only challenge is that those of us who earn a little more are sacrificing a little. You pay a little more, but then it saves you from attending so many harambes. So eventually, there is a balance in terms of your income. And then those who are paying lowest, 500 shillings, are now paying 300. And those who can't afford the 300, there will be a means testing tool which will waive the 300. So I'm wondering how really honest we can be to oppose a health insurance scheme that is free to those who cannot afford. It's a very difficult task to oppose such a scheme. So we are going to partner with county governments and also through the National Equipment Support Program, which I think all counties have signed to. That program will give us the access to equipment, especially for lower level hospitals, level 2, 3, and 4, so that Taifa Care can function and the referral system can function when you have diagnostic capabilities at the lower level hospitals.